This week, Medical Observer brings you In Conversation with Byron Kaye.
The name of the report says it all. The prohibition of illicit drugs is killing and criminalising our children, and we are all letting it happen. If that all sounds a bit over the top, it's been supported by some of the country's top doctors, police, and even the Foreign Minister. So what are we to do about it instead? We're joined this week by Dr. Ray Seidler, who's been a GP in Sydney's King's Cross for over 30 years and is involved in just about every aspect of general practice. He's also an addiction specialist, so he's probably better placed than most to tell us just how well the so-called war on drugs is going. Dr. Seidler, thanks so much for joining us.
Thanks, Brian.
It's easy enough to say that the war on drugs has failed, but where is the proof, and what's to say that some other approach would be more appropriate or effective?
The evidence, I think, Brian, is clear in that our jails are being built at an ever-increasing rate, and a large proportion of the Australians that we place in jails are there for drug-related crime. And I see a proportion of those patients in this practice in King's Cross, which is pretty much traditionally the epicentre of the drug problem in Australia. There are more drug users who frequent this suburb than most, but that's not to say that the problem doesn't exist all over Australia. The cost to the community is immeasurable, the cost to the people involved is huge, and the cost to the medical and criminal justice systems is equally huge. But I think most doctors realise that the war on drugs has been an abject failure. And most doctors have a patient or two in their practice, even if they work in a rarefied suburb, who use illicit drugs, and they see the chaos it produces in the individuals and the families involved. And there's nothing worse than seeing the kids and the parents of a drug user implode as they slowly descend into chaos.
Experts can sit around and talk about decriminalising heroin or something. How does that work, trying to explain to, say, the family of someone who has been affected by heroin or perhaps even lost their life to heroin? How can you say to them decriminalising would be better?
Well, I think the issue with heroin is that by nature of its illegality and its illicitness, that we have a drug out there on the street that is impure, that is unable to be tested in terms of its potency, so that people virtually play Russian roulette every time they have a shot. And that means that they never know whether they're going to overdose or not, or whether they're using an impure drug which will lead them to get what we know is subacute bacterial endocarditis or discitis or some other dread complication as a result of putting an impure substance into their circulatory system. This occurs more often than not. Many people don't die from heroin but get seriously sick and end up in our hospitals having, valve replacements for subacute bacterial endocarditis, or having back surgery for a chronic inflamed disc that's been caused by a bacterial infection that's been injected inadvertently into their veins. Now, you can give them clean equipment and you can give them clean needles, and we've done that very successfully in Australia, but you can't supply them with clean heroin at a dose that is effectively pharmaceutically established so that we know what dose that we're using. So we have treatments for heroin, but they're pretty much unattractive to many drug users who want the king of all drugs to provide them with the relief that they need from what is often psychic and psychiatric pain. And they're not satisfied with the treatments we offer them. Buprenorphine and methadone are kind of second-tier drugs in terms of what they provide people with. Now, I'm not saying that the drug should necessarily be injected, but we could find cleverer ways of applying illicit drugs to the person, and that means that you could find a transdermal way of applying heroin, you could find an inhaled way or a smoked way. There are many ways that they could take these drugs, and we need to get creative about how we approach that.
The war on drugs has been going for a long time, and we've seen the rise of lots of different and new illicit drugs,
yes,
such as methamphetamine, ketamine, GHB. Has this changed the playing field, or the battlefield, so to speak?
Drug dealers are very innovative. Crystal methamphetamine is a real scourge at the moment, and you only have to work in a psychiatric hospital or in an emergency room to see young people coming in with acute psychosis. And that's a drug that's really had an incredible increase in its use as a result of the prevalence of people trying to shut down heroin. And we've kind of traded one drug for another, and this new drug is far more dangerous in many ways than the older ones. When somebody gets psychotic on ice, they become unmanageable, violent, both to themselves and to people around them. And that's why St Vincent's and Liverpool and a few other hospitals have psychiatric emergency centres, largely to deal with the epidemic of crystal methamphetamine.
You're a GP in a part of Australia which is almost synonymous with drug addiction. What do you think you've seen in this area that perhaps the rest of us haven't? I
see terrible comorbidity in these patients that is often untreated because of their drug addiction, and because if they approach other doctors, their drug addiction is seen as a negative, and it usually allows them very poor treatment in terms of their general health. They often die much younger than the rest of the population. They often have terrible dental decay. They often get cancer 15 or 20 years earlier than the rest of the population because their immune systems have been stuffed by the 16 hours a day that they have to run around the streets picking up enough money to buy the drugs. And contrary to popular belief, they don't usually steal until they've depleted their own resources and those of their immediate family. They have terrible comorbid psychiatric problems that are often the reason that they start using drugs. Things like untreated depression, untreated psychosis, untreated even obsessive compulsive disorder, or even generalised anxiety disorder, or other problems that have never really been tackled in Australia, and they've gone straight to the street to relieve their psychic pain.
Dr. Seidler, thanks so much for your time.
A great pleasure. Thank you.